And then share screen. Present. Okay, so how's it going? I'm gonna do the first introduction part of it, right?
Mm-hmm.
So I'm gonna just do it. How's it going, you guys? My name's Vinny, and for our presentation, we did different responses to COVID-19 around the world. The purpose of this presentation is to show how certain countries handled the COVID pandemic. And then we are going to show you how countries such as Japan, Spain, Italy, United States, and New Zealand, how they initially responded to COVID, how many total deaths and case numbers they have, and then how they are currently dealing with the pandemic now. Then we'll go to next. It's not. Okay, it's not. Oh, wait. Oh, of course, it was just lagging.
Oh.
So boom.
Okay, so hi everyone, my name is Sasha. And so first of all, what is COVID-19? And then, So COVID-19 is a novel coronavirus related to SARS and MERS. It was named Coronavirus Disease 2019 or COVID-19 by the World Health Organization on the 11th of February this year. Most of the effects of the disease are on the respiratory system, but they can also attack any organ system. The risk of severe illness or death by COVID-19 increases with age and underlying conditions. And COVID-19 started in Wuhan, China in early December of 2019, and it has spread across the globe. Countries have implemented a number of measures to inhibit its spread, and as of right now, there's no approved antiviral drug or vaccine for the disease. First, we'll be talking about Japan's response to COVID-19. So despite Japan's close proximity to China, their large elderly population and their high urban population density, they have managed to keep their initial COVID-19 rates low. The country's collectivist ideals, along with their 5-part mitigation plan, work together to keep their disease numbers low with relatively little testing. Their 5-part plan includes a containment phase, a reinforcement of the medical system, a mitigation phase, an emergency phase, and a recovery phase. Here you can see the little amount of testing that Japan has done in comparison to many other countries around the world. So first, we have the containment phase. On January 28th, the Prime Minister announced COVID-19 was an infectious disease under the infectious disease law, and their early efforts included managing new cases originating from a cruise ship called the Diamond Princess. Then, for reinforcing the medical system, in February, medical centers were instructed to increase their capacities, and 536 consultation centers were created for COVID-19. During their mitigation phase, the basic countermeasure policy for COVID-19 was created, and a week later, was created on the 20th of February, and a week later, all schools were closed until early April. The government also subsidized companies to pay workers to take care of their children. They expanded national health care to cover COVID-19, and they used phone data to track the mobility of people in different areas, and they alerted hospitals in areas of high mobility. During their emergency phase, an amendment to the Influenza Act of 2012 allowed the Prime Minister to enact a state of emergency in areas of higher COVID-19. And on April 16th, the national emergency was extended to cover all of Japan. Here you can see when each of these phases were enacted. And so how is Japan doing now? On May 25th, the national emergency was lifted for all of Japan, and so they're now in the recovery phase. And as of October 13th, Japan has had 89,673 confirmed cases and 1,634 deaths, making their death rate 1.8% and the recovery rate 92.1%. Japanese collectivist values were also also allowed for their low rates of COVID-19. Social distancing and masks wearing were very easy to abide by, as most people still wear a mask, will wear a mask if they feel sick or if it is flu season, and they have contactless greetings such as bowing instead of shaking hands.
And so this is how Italy responded to COVID-19. So Italy reported its first case of COVID on January 30th, 2020. The very next day, it went into lockdown and declared a state of emergency for a period of 6 months. Following China, Italy became the second epicenter of the pandemic due to the amount of cases they were facing. Even though Italy responded and acted quickly to the lockdown, it was still hit hard with COVID due to the large population of elderly people in the country. Like the United States, Italy's medical facilities couldn't handle the overwhelming amount of new patients coming in and did not have enough equipment to satisfy everybody. Thankfully, the Italian government came to save the day, giving more rooms and equipment to help everyone in need. One good tradition that the people in Italy would do is they would go outside and applaud the medical workers and essential workers for their hard work during this time. And then Italy currently has a total number of 333,940 cases. Their total deaths are 36,061. And then total recovered are 235,303. And then I just have some graphs about the total coronavirus cases in Italy. As you can see, it kind of flattened out over the summer and stuff. And then these are daily new cases as from the beginning to the end. Total deaths. And then how Italy is currently dealing with COVID. So Italy is currently handling the pandemic very well right now. There are currently less than a dozen deaths per day. There's also typically around only 100 new cases per day. However, there are some spikes in cases that happen every so often due to that social distancing and masks are still required. There is also long sentence. An example of a spike that happened recently was on October 1st, with a record of 2,000 new cases being reported. This was a record high since April. The lockdown was lifted in May, but schools and nightclubs remain closed. Restaurants and businesses such as spas, gyms, and churches are currently open as well. Travel restrictions still apply. However, some countries like Australia and New Zealand can travel freely from there to Italy and have no problem.
All right. Hi, my name is Juliana, and I'm going to be talking about how Spain had responded to COVID-19. So on March 14th, 2020, Spain declared a state of emergency and a national lockdown. People had to stay in their homes. All schools were closed. Stores, hotels, and restaurants were temporarily shut down. While this was happening, Spain implemented other measures to ease the social and economic damages caused by the lockdown. These measures included protecting families and vulnerable people, supporting workers' employment and production, and helping out businesses that were struggling. Spain was one of the European countries that suffered the most early on from coronavirus. On March 14th, 2020, Spain passed 40,000 cases. By the end of September, Spain had 800,000 cases. Their cases have continued rising. When the government began the lockdown on March 14th, Spain had 196 deaths from coronavirus. By September 30th, Spain had 31,791 deaths. As cases began to rise significantly in August, the daily death rate remained fairly constant due to the improved health measures. Now, Spain is starting to see a second wave. In particular, Madrid is not doing well. They have several hotspots emerging around the city. On September 22nd, Madrid reported 953 new cases for that day. Parts of the capital are on a second lockdown. The Spanish Prime Minister Pedro Sanchez said that more severe measures could be introduced if things continue to get worse.
My name is Jimena, and I did the US response to COVID. On January 22, the first COVID case was confirmed in Washington state. On March 11th, US President Trump suspended the entry of foreign nationals who have traveled in the continental Europe. As a country, we never had a lockdown, but most states decided to quarantine by the end of March. What I mean by quarantine is many states decided to take safety protocols like shutting down businesses. On March 16, the president announced social distancing guidelines to be placed for 2 weeks. And then Americans were panic buying, meaning that Americans were going crazy about toilet paper and all supplies like gloves, masks, Lysol hand sanitizer, or any sanitized products. So this is an example of how one state is monitoring COVID. So actually, California made a tier system. So we were in the first tier, which was widespread, where we couldn't go out, all businesses were closed, gyms, salons, everything. And now California is actually in the red zone, where you can go inside the gyms, work out, or get your nails done inside a salon. Okay, so this is a graph of the total cases. You can tell that since October 10th, there's been more than 7,400,000 cases. That's it. And then for total deaths, US has had more than 200,000 deaths. And then as of October 10th, there's been 215,359 cases. And then how is the US doing now? The US has the most reported deaths in the world. Even though it's required to wear face masks in the public spaces, some people are still refusing to wear them. So as you can tell in the image next to it, you can tell more than half the US states are required to face masks, but not all of them. Recently, the US president tested positive for COVID, also his wife. And then overall, supplies are pretty much everywhere now, and there's no more shortage of supplies. And then as for testing wise, there are many local testing sites you can go to.
Hi everybody, I'm Daniel, and I did research in New Zealand's response to COVID. So New Zealand ended up having the most efficient response to COVID out of every country in the world, mostly because it's a pretty small country, it's an island, and they had an easy time keeping people out and keeping people inside. The population there is older, so when COVID first started, people were definitely worried about how the death rate would look in New Zealand. But as we'll see, it turned out that there was no reason for anyone to be worried because the country entered a level 4 lockdown for 7 weeks straight. Next.
Hold on. Sorry, it's glitching out.
Yeah.
Wait, did I go one too far? No.
One second. Okay. So New Zealand's case rate, they managed over the last 9 months to keep their case rate extremely low. They've had less than 2,000 cases since the pandemic began, and out of those, only 25 people have died. And they absolutely did the best job of any country because they started this campaign early on in the lockdown called Unite Against COVID, and it was basically inspiring like a social dynamic where people were really willing to help do their part by wearing a mask and staying inside for longer than just about any other country in the world. And since May, actually, the only added cases to their case count have been international travelers, which is interesting. And then this is a chart of cases. You can see that between March and April was like the only time that cases ever spiked there. And after April weekend, there was never a time or a day where there was more than 25 new cases. How's New Zealand doing now? So New Zealand is technically in like a post-elimination stage. You can see in these photos, like people walk around and don't necessarily have masks on, but there's still social distancing guidelines in place. It's just that the virus doesn't even exist in the country right now, so people are able to go on and live their normal lives. The biggest challenge that New Zealand's faced is tourism, or like the lack of, because their economy is almost completely based on people coming to visit and spending money there. And so for a while they were having no visitors, and now there's like a quarantine process, and basically when you arrive, you spend 2 weeks in quarantine. And schools are back, and they're about to have summer for the first time this year, which is going to be interesting to see what happens when all the kids are out of school. Okay, so in conclusion, what we were trying to demonstrate was that communication is very important, especially when it comes to a global pandemic. The dynamic that the government set for its citizens was demonstrated in the case count in a country like the US, where there was so pressure to not wear masks, and people really as willing to conform. We can see that there's almost 8 million cases in a country like New Zealand, where immediately everyone took it really seriously. They've managed to ask us. And so just to tie it all together, and back to the communication, we can really see the difference between empathy and indifference. When a leader is empathizing with its citizens and is taking part, and we can also see when a leader kind of decides to kind of sit back and let things happen as happen. But that's more about leadership and orientation, and if a leader kind of sees it as a problem or something that they need to control. But yeah.
See, and then that's it right there, huh? So honestly, I thought that was pretty good. I feel like time-wise, we're not like too long or anything, but we're also not like too short either.
Yeah, I thought it was good.
Yeah.
Me too.
Sweet. Okay, so I'm gonna stop recording.